Hi, I'm Dr. Vance Raham. I'm the lead addictionologist for Tanner Health Systems based in Carrollton, Georgia. I work out of Willowbrooke at Tanner in Villa Rica, Georgia. We have concerns through the staff at Willowbrooke that there are people out there that are in recovery and are trying to stay in recovery or to get into recovery that are very stressed emotionally because of what's going on with the COVID-19 virus crisis. We have been put under self-isolation. We are not able to go to meetings face-to-face. I myself have been in recovery for 15 years from opiates, and I know the importance of going to meetings, to socializing, to being able to work with your sponsor. We are not able to do that face-to-face anymore. So what do we do about this? Well, we have to find ways to do a virtual 12-step meeting that we're not able to do in person, because those meetings give us good, normal, healthy dopamine levels, as opposed to the dopamine levels we got from using our drug of choice, which seemed to work for a while and then failed us miserably. So how do we do this? What do? We can't be face-to-face anymore. Well, one of the options that you have is to go to this site, www.intherooms.com. They set up virtual meetings and have about 130 meetings a week that are scheduled. You can do and make as close as possible to a 12-step meeting by doing it virtually. There's lots of subjects, lots of different types of meetings. You should be able to find something that you're interested in that can help you. Just to make sure you know you get to the right site, this is what it should look like when you get there. Another option that you have that is not meeting-based, but it is AA and 12-step based, is going to this site, recoveryaudio.org. That site, as you see here, has 6,000 AA speakers and tapes. You can go there and talk to your sponsor about this, someone that has quite a bit of sobriety. Find speakers that are old-timers that know what they're talking about and listen to them first. You have to be very careful to make sure that you're not listening to a speaker that may not be telling you the best thing in the world. But this site is very good at being able to give you good, clear 12-step sort of audio. Joe and Charlie's great to check out. They've got their complete big book series that's on this site that you can go through, and that will keep you busy for a long time. You also can find Father Martin and several other old-timers that you can listen to. Another thing you can do is recently I started a YouTube page. This is the banner for it. And if you do the search here under Addiction Doc, all one word, you should be able to find this. If you don't and you get a list of things in a search, it will show like this. So you can see the avatar a little bigger, looks like this. Yes, I had facial hair when I drew that and I shaved it off. So that should get you to the site. Now, what do you do with this information? What you can do is you get a hold of your friends. You either use Zoom or YouTube or Duo or Facebook or Messenger or what other platform you have to go and get your friends together. Even if it's one or two people, say, hey, look, let's all go to YouTube. Let's go find the Addiction Doc site. Let's all find one video we're going to watch. And you all watch it on your own computer, phone, whatever you may be using. And then afterwards, you get together in a group phone call and you discuss it for 15 minutes or a half hour. That's as close as you're going to get to a meeting these days. So just because we're socially isolated, physically isolated, doesn't mean that we have to be mentally isolated or emotionally isolated. Being alone is okay, but being lonely is not. Being by ourselves is not a good option for us because we get to start rummaging around in our head, what we should not be doing, and can talk ourselves into doing bad things or good things, whatever is going through our mind at the moment. So make sure you got a sponsor. Talk to your sponsor every day. If you don't have a sponsor, be a sponsor for someone or find a sponsor. Go find what you can out there that can keep you clean and sober. Keep your program first, your higher power first, and you have a great chance of staying clean and sober. If you put anything above that, you have a great chance of relapsing. Be good, be safe, and be clean and sober, joyous, happy, and free. Thank you.